Hi, welcome back. I'm Nicholas Cohen. I'm a board certified family doctor. I'm currently focused on helping people lower their cholesterol. I've been helping patients lower their cholesterol for over a decade. And in this series of videos, I'm going to be focusing my message to the public. So, why you might want to be interested in what I've got to offer is I'm going by the highest level of evidence. My recommendations are consistent with the most up-to-date clinical guidelines, and I rely on lifestyle. I rely primarily on diet to achieve cholesterol goals. That is often not what you're offered in a routine primary care office visit if you have high cholesterol. Often you're just given a medication. I'm going to be providing you with the option to change your diet to achieve your cholesterol goals. In the prior video, I described how to determine your risk and your LDL cholesterol goal. In summary, we looked at the 10-year risk calculator, and I said that if you have a 5% or greater 10-year risk, your LDL goal should be less than 70. If you have a less than 5% 10-year risk, your LDL goal should be less than 100. I want to say one more thing about determining your risk and your LDL goal before I move on to the topic for today, which is going to be designing your overall strategy for lowering your cholesterol. What I want to mention are alternative methods for determining your cardiovascular disease risk. This is your family history, an imaging test, and 2 blood tests. Let's say you have a less than 5% 10-year risk. If you have a male first-degree relative, brother or father, who before age 55 had a heart attack or stroke, you are at high risk, which means you should opt for that LDL goal of less than 70 instead of less than 100, independent of what your 10-year risk might have been. Similarly, if you have a female first-degree relative who had a heart attack or stroke before age 65, then your LDL goal should be less than 70 as well, independent of your 10-year risk. There is also the coronary artery calcium score. This is a test on the horizon that is more and more frequently used in routine care. It is usually not covered by insurance, but it can independently determine your risk for cardiovascular disease. So if you have the coronary artery calcium score available and you're willing to potentially pay out of pocket for it, I recommend you get it, especially if your 10-year risk is less than 5%. Because if you have a high risk based on your coronary artery calcium score, you as well should lower your LDL target to less than 70. And then there are 2 lab tests. Both are on the horizon, both probably not covered by insurance, but both can be helpful at independently determining your cardiovascular disease risk. That's apolipoprotein B and lipoprotein a. If you have the option to get these tests done, get them done. If they put you at high risk, independent of your 10-year risk based on the calculator, I recommend that you have an LDL goal of less than 70, the more aggressive goal. So in summary, if you have a family history, if you have a 10-year risk of 5% or greater, or if you have a coronary artery calcium score, apolipoprotein B, or lipoprotein a in a high-risk range, I recommend you have an LDL cholesterol lowering goal of less than 70. Otherwise, go for a goal of less than 100. So that's wrapping up risk determination. Now let's talk about treatment. What to do. And here's where I differ from most of my colleagues in primary care. I am going to focus on diet first. There's a caveat though. There are some people who I will want to start on medication immediately. The medication of choice are the statin drugs like Lipitor or Crestor. If a person has an LDL of 190 or greater, if a person has that family history we talked about, if that person has a previous history of a heart attack or stroke, or if that person has a 10-year risk of 20% or greater, I'm going to recommend starting a statin right away. Otherwise, I give my patients the option of diet first. And even if I am starting a statin medication, I'm going to be starting diet alongside of that. So diet is basically the right move for everybody. So I'll give somebody my 12-week cholesterol lowering program through diet. In the first 6 weeks, they will be making the diet changes. In the next 6 weeks, they'll be sustaining those diet changes. Then they'll get their cholesterol rechecked. We'll see if they've reached their LDL goal, and then we'll go from there. Once I have that result from after they've completed that diet program, I will offer them the option, if they're not at goal yet, of supplements first or medication. The reason why I don't insist on supplements for everybody, and there are 5 supplements I recommend, is because it can get expensive. You could pay a couple of dollars a day to take the 5 supplements that are highly effective for lowering cholesterol. Oftentimes, you can take a cholesterol lowering medication for free. It's covered by your insurance. So if cost is a real driver for your decisions, a lot of people will opt for medication instead of supplements first. If you can afford the supplements, I recommend that be the next step after the diet. So I'll put people on these 5 supplements. They'll be taking them for an additional 12 weeks. We'll get their cholesterol rechecked. If their LDL is still not at goal, then we will discuss medication. So in summary, we've discussed how to calculate your risk and how to determine your LDL cholesterol lowering goal. We described a diet first approach, except in certain cases where it's important to start a medication right away because the risk is so high. We discussed a tiered approach where after diet is in place, we reassess, consider supplements, reassess, and then consider medication if absolutely necessary. The reason it's so important to have your diet right, even if you could just get your cholesterol goal to where it needs to be with medication, is because the diet that you follow to lower your cholesterol is also the diet that lowers inflammation. It's also the diet that lowers blood pressure, and it's also the diet that lowers blood sugar. And it's also the diet that leads to a longer lifespan, even when we control for all of those measurements. So I never want to deny someone the option of changing their diet, regardless of what medications may or not be necessary in the future. Next week, I'm going to take an even deeper dive into the diet I recommend to my patients that is highly effective and proven to lower LDL cholesterol. I'll see you next week. And if you want to be sure not to miss a future episode, you can click on the link to get my emails. The link is below. See you next week.